Hello there. Very happy to be here again. So, I wanted to talk to you today about regulation thermography. And we have been sharing quite a bit of information about regulation thermography, but I wanted to share a little bit more about my personal experience with regulation thermography and how I discovered it and what it meant to me, and how it has been an amazing tool for us in our practice to be able to help so many people. So in 2019, that was the first time I learned about regulation thermography. I did know about thermography for a while now, but the one that I had known about was something called as camera thermography. And that's not the same as a regulation thermography. The camera thermography is really not FDA cleared or approved for medical use or diagnostic use. And I didn't know that about that back then. So, and then I learned something about regulation thermography. When I heard that term, it didn't mean anything to me. I had no idea what it means, and so on and so forth. And then I went ahead and had a regulation thermography testing for myself. What is the best way to learn about anything is to experience it, right? So I wanted to know more about my own body. So I had the testing done. And you have to remember that I am at this point in time in 2019 and today as well, I was a very healthy person, no visible problems, nothing that I was taking any ongoing treatment for myself, even not, and not even that many supplements. And so this is what I was doing at that time. I had no aches and pains or anything that was really terrible. Nothing that I could think of, no diagnosis per se. So I had the regulation thermography to just understand, because the regulation thermography um, tells us more about the dysfunction that's happening even before disease appears. And why not, right? It's always a good thing to see what's happening in our body. And I always am a big advocate of that, to learn what's happening in our body and prevent problems rather than just treat them once we have them. So that's what I did. And lo and behold, when the report came, I was shocked. That's an understatement, because it showed that I had quite a high possibility of developing cancer. So, the reason why I'm sharing this with you is because a lot of us think that way. If I hadn't been in the field I'm in, treating sick people day in and day out, I wouldn't have understood what this meant, or I wouldn't have even had that test, or I wouldn't have even probably been exposed to it. And that was the reason why, or that is the reason why today I'm actually doing this live, because I kind of wanted to tell people what's out there. And if you don't even know it exists, how can you utilize it? So when I saw that, I was beyond shocked, because here I am, I exercise regularly. I've been exercising regularly for 18 years now. I drink plenty of water. I eat very healthy. What I advocate, I walk the talk. And it was shocking to me that that was what my body was doing internally. And then I realized and learned more about the emotional health, and how certain experiences in our from our past can actually affect our body and even increase certain kinds of problems in our body or certain diseases in our body. And I also learned about how my lymphatic system was functioning for the first time. I'd had blood work that showed how my liver was functioning, possibly just two liver enzymes, but at least a little bit. There were tests that showed how my iron was. There were tests in the blood work that showed how my cholesterol was. Even though it was still very limited, I still had some idea of what was happening in my body, or at least that's what I thought. But I had no test ever for identifying how my lymphatic health was. And this test showed that my lymphatic system was functioning very poorly, and I had a lot of heavy metals in my body, which I had no clue again. And a lot of times, these are the times where you can actually either wake up and do something about it or live in denial. And I choose to wake up and do something about problems. I don't like to live in denial. I don't like to close my eyes and think that the world doesn't exist. So I started working on that. And after a period of time when it was repeated, that terrain index that was very high for cancer is gone. So this can actually be a very clear indicator that we don't have to just do a test and get a label that's going to tell us that we have this disease and that's about it. Instead, we can actually identify things ahead of time and even prevent it from becoming a full blown disease. Or even if there is something that's already forming, we can actually still heal that body. And that's just how amazing a human body is. And you know that I believe in that completely, and I say that time and time and time again, how amazing, how miraculous the human body is, and how it can actually heal so many different things when we do things right. So, and it was just an eye opener for me, this whole test. So, and that's the reason why I realized that this is a test that is essential for anybody, no matter how old you are. This is something that can be done for anybody over the age of 4, for men and women alike. And it can actually show so many different dysfunction, and it can also show the health of each and every important organ in your body. So, the difference between the camera thermography that I was mentioning about earlier is something where they'll actually have a camera farther away from your body, and they'll actually, emit infrared light rays directly onto the body and be able to measure or look at the temperature patterns by capturing images. Versus regulatory thermography or regulation thermography is something where it's non invasive, still, it's painless, it is FDA cleared, but it is actually done with probes. So, this is the probe that we use to actually check 90 to 120 points depending on the sex and the age of the person. So we actually go like this on each part of the skin in different points and measure with infrared the different temperature patterns inside. So it's not just something that you're measuring on the surface of the skin, but you're actually understanding what's happening internally. So, if you think about how when we actually have a fever sometimes, that can be an indicator of if there is a viral growth or a bacterial growth or some kind of an infection going on. Something is happening in our body, and the body lets us know by increasing the body temperature. And it's also trying to fight off the same problem by increasing the body temperature. So, whenever we have a problem in any part of our body, the body increases the circulation. And if there is a problem where it's actually blocked, that temperature goes down in that area. So that's what the regulation thermography captures. And these data then gets converted through algorithms into information that we can read and understand and see what dysfunctions are happening in the body. So as I showed you, just a probe where it's non-invasive, there is no radiation for it. It is FDA cleared and it is truly a preventative tool, because without that tool, I wouldn't have been able to see what was happening inside my body. And I'll give you another example of one of my patients. So, this patient of mine came with ADD, and this child, when we did the regulation thermography for this child, what we actually saw was we saw that the brain wasn't getting enough blood supply. And it's actually always very interesting, isn't it? That we actually think of something as, oh, do we have this problem? Do I have ADD? Do I have this problem or not? Here it actually showed clearly that there was a problem where the circulation to the brain was definitely much, much lesser. And that child also showed heavy metal toxicity. So, which means that heavy metals generally have an affinity towards the brain and the nervous system. So, in this child's case, that was the case. He had high heavy metal toxicity, and the circulation to the brain was diminished because of that. And we actually did the treatment and we retested that child in a year's time, and it showed that the circulation to the brain had been established. And another patient came to me with migraine, and we did not actually do regulation thermography for that reason. That was something that was very easy to resolve, and we resolved it. But then she was asking me about a form of testing that can actually be a true preventative tool. And then I asked her to do the regulation thermography. And when she did it, we again saw that she had a moderate to high possibility of developing cancer. And then again, we treated, and a year later, we repeated the thermogram, and that possibility of developing cancer was completely gone. And that's how miraculous this is. So many people don't get these tests, don't go for any kind of testing, blood work, mammograms, colonoscopy, or regulation thermography, because they don't want to know what is happening in their body. They believe that the moment they actually know, they are going to be labeled a certain way, and that means that they have to live with that disease for the rest of their life. That is not how it is. With this is a preventive tool, which means that when we understand a dysfunction happening 7 to 10 years prior to sometimes a disease developing, then we can truly prevent the disease from developing, right? And that's how it is. Most diseases are cancer, diabetes, dementia, Alzheimer's. All the chronic diseases do not develop overnight, even though that's how we are told. If you think about it, most people who do get diagnosed with cancer, it seems like one bad morning, they just got diagnosed. But it is never that case. Your body gives you many, many different signs and symptoms that are very mild, though, and we may not be able to catch it with our naked eye or with our understanding, even. And that's where this tool comes into picture. So, this is something that I recommend for every single person to have, especially if you have any kind of health issues. And if you don't have any health issues and you're still over 30, get it done and at least establish a baseline. If you don't really have anything going on and we actually see that your health is pretty good, then you only have to repeat it once every 2 or 3 years to make sure that you're staying healthy. And if you do have any diseases, you want to find the root cause of that problem. And that root cause you can find out. For example, in patients with, for example, hypothyroidism, many a times we see that the thyroid itself is actually functioning okay in the sense that the cause of the problem is not in the thyroid, but maybe it is in the liver. Or maybe the patient has heavy metals in the thyroid, and that is actually contributing to the thyroid not functioning optimally. Or maybe they have a pituitary problem, and that is actually contributing to the thyroid not functioning properly, maybe because there is heavy metals in the pituitary. So there is so many different understanding that needs to happen in between for any disease. A disease is not just in that particular organ. Many a times the cause exists elsewhere. So in case of breast cancer, for example, there are 13 points that we actually consider for someone to develop breast cancer. So breast cancer just does not develop in the breast. It is actually something that develops, in the breast, but it actually develops because of many other reasons other than the breast. So, one of the most commonest reasons for breast cancer to develop is the lymphatic index being very high. That means the lymphatic system is highly compromised and overburdened with toxins. And when this happens, the tissue which is closest to that lymphatic tissue is going to get compromised as well. And the toxic load starts increasing in that tissue, which means that that organ can get any kind of disease. So this is for any type of cancer, but breast cancer specifically I'm mentioning here because breasts are lymphatic tissues by themselves. So which means that if the lymphatic system is compromised, then the breast can highly get affected. And in men, this is also true For men, in case of prostate, that's the area where it actually commonly gets affected because there's a lot of lymphatic tissues in that area as well. So if that lymphatic system isn't functioning properly in that area, then we can have a very high lymphatic terrain index, which means that the toxins can slowly build up in that organ, causing mutations and eventually even cancer. So now that we understand how diseases develop over a period of time, wouldn't we want to know how each of our organs are functioning and what we can do to improve their function? What can we do to promote health in our body? So, if you are over 30, you need to absolutely get this testing done. And if we see any kind of issue, then we start treatment and we'll be able to fix it. And if we don't see any issues, it means that a lot of the things that you're doing are working well and we want to continue doing it. And then we repeat the test every few years to make sure that you're staying healthy. So, what are the things that regulation thermography can actually identify? What can a report tell you? It can tell you about your lymphatic health. It can tell you about your hormonal health. It can tell you about your endocrine health, like your adrenals, your thyroid, your pancreas, your pituitary, your thymus, and so much more. It can also tell you about your cancer terrain or lymphatic terrain index. So, as I was mentioning about the breast cancer, there are 13 points, and one of the major points is the lymphatic system, but other areas that you also pay attention to is your teeth. So, each single tooth is connected to a meridian. A meridian can actually be connected to many different organs. So, it can be a lung meridian, it can be a liver meridian, it can be a kidney meridian, and so on and so forth. So, depending on where the problem is in the gums or teeth, you can actually have problems in those organs associated with it. And there are some breast meridians as well. So, if a person has tooth toxicity or gum issues or hidden focal infections in the teeth, that can actually cause problems in the breast. So, that is another point that's considered. Another thing that you need to know about is your liver health. Liver is absolutely essential, and we only have two enzymes, or three at the most, we actually measure in our liver enzymes during the blood test. So the liver does so many different things. So this is not really a clear indicator of how your liver is functioning. And liver function is essential for breast health as well. And this is also another criteria that is considered for breast cancer. The other one is stomach and enzyme function and how the stomach is working. If the stomach is cold, that is another point towards breast health, whether it's actually going to be healthy or diseased. And then ovaries. So there's so many things that we need to look at for just one thing. And here we are, we just think that, we just develop a disease and we cannot do anything but just take a medication. But we have so much more power than you think. What else can it actually tell you? It can tell you about your liver and your gut health. It can tell you about your enzyme function. Are you producing enough enzymes? Are you having enzyme deficiencies? Are you having insulin resistance patterns? How is your pancreas functioning? It can tell you how your adrenals are functioning. It can tell you whether you have gut dysbiosis. What that means is there an imbalance of good bacteria versus fungi and mycoplasma and things that are not really good for you. It also can show you dental toxicity. It shows you dental health and gum health. And this is again another important aspect. And in this case, I can tell you about another patient of mine who actually had a thermography last year, and they had amalgam fillings in their teeth. So two of them actually had this, and they had amalgam fillings in their mouth, and they went ahead and got it removed, after I told them to do so. And after they removed it, we actually just recently did a thermogram for them, and the dental toxicity is gone. So it's amazing how, when we make these small changes over a period of time, that our body changes with us and gives us the gift of health. Another thing that it can tell you is viral, bacterial, fungal, and even Lyme infection signatures. So a lot of people who have Lyme don't even know that they have Lyme. And this is something that can actually show them that as well. It can show you, of course, heavy metal toxicity. and the body's ability to detoxify through the kidneys and the liver. It can show brain toxicity, it can show the heart health, lung health, kidney health, and so much more. I mean, it's actually one of those tests that is truly comprehensive and truly preventative. So, today, I want to urge you to take this as your, um, you know, recommendation, or even, my urging you to go and get this regulation thermography done, because this can truly save lives and it can truly prevent problems in the long term. Okay, it's such a small investment in your health. Okay, so hi, Nimisha. I'm happy to answer any questions if you have about regulation thermography now. Okay, it's such a small investment in your health. Okay, so hi, Prativa. Okay, you can always contact our office, and we are going to actually come up with an offer for all of you viewers this Friday, which is, yeah, in 2 days. And you can, avail this offer, and you can always call our office for more questions, or if you don't understand much about it still. And you can also go to our website at hygiehomeopathy.com/thermography, and you'll be able to learn so much more than what I just shared as to how it can be an amazing tool for you and your family. Okay, so I look forward to seeing you in here. Take care of yourself. You are totally worth it. Talk to you soon. Bye bye.